The common cold is aptly named as nearly everyone catches colds. I have one today. In fact, the U.S. population experiences nearly 1 billion colds annually. And common colds are the main reason that children miss school and adults miss work. And conventional medicine doesn't have a lot to offer for treating the cold. So as a result, a lot of you turn to natural medicines. So what works, if anything? We'll talk about that on today's edition of Ask Dr. Walt.
Today, our health includes our mind, our body, and our spirit. Separating medical facts from fiction is the key that leads to wise decisions about our health and well-being. Unpacking the latest research is vital. Doing what works helps us live our best lives today. How can we live longer? How can we live healthier? Let's ask Dr. Walt on Liftable TV.
Hi everyone, I'm family physician Dr. Walt Larimore. More than 200 different viruses can cause colds. Now, the rhinovirus is the most common and can occur throughout the year. During the autumn months, rhinoviruses cause 80% of all upper respiratory infections. And the viruses causing colds are spread directly by physical contact, such as shaking hands or touching doorknobs, and indirectly through airborne transmission, like from coughs or sneezes. They can also spread indirectly from environmental surfaces like desktops, countertops, keyboards, telephones, doorknobs, as I mentioned. And if you touch these and they have the virus, and then you subsequently touch your eye, nose, mouth, tongue, lips, it can easily and quickly lead to infection. The bottom line is that nearly everyone exposed to a cold virus becomes infected. So avoiding exposure is the first place, and much better than actually trying to treat the cold. But the good news is that there are several safe, effective, and simple ways to prevent the cold and flu. And you've heard these even in our pandemic with COVID. Avoid people who are ill as much as possible. Wash your hands with soap and water frequently, especially when around infected patients or infected places. And patients will often ask me, how long should you wash your hands? And I say, as long as it takes you to sing happy birthday. And alcohol-based hand sanitizers are another good option. Once again, avoid touching your mucous membranes like eyes, ear, nose, and that sort of thing to self-inoculate yourself with cold viruses. Keep work, bathroom, and home surfaces clean with disposable disinfecting wipes. Be sure the label says that it works against cold and flu viruses. But with the best prevention, you and people you know in your family are sometimes going to come down with a cold, just like Dr. Walt. And common treatments of the symptoms for common cold include staying hydrated, getting rest, gargles or lozenges for a sore throat, maybe saline or decongestant drops for nasal congestion. How about warm liquids like grandma's chicken soup? And then pain and fever relievers like acetaminophen, ibuprofen, or naproxen. But none of these traditional suggestions have been proven to shorten the duration of cold. And some have side effects. No wonder lots of you use natural medicines for colds. And the good news is there are some possible treatments that have some evidence for both reducing symptoms and speeding recovery from the common cold. So if you choose to take or give your children a natural medicine, what works and what doesn't? Well, to help us navigate between literally thousands of options is my good friend and our guest today, Todd Cooperman, MD. Dr. Cooperman is an internationally recognized and respected researcher, writer, and speaker on consumer health issues. His MD degree is from Boston University School of Medicine, and early in his career, he founded one of my favorite websites, consumerlab.com. I consider it the leading independent evaluator of dietary supplements and nutritional products. Dr. Cooperman, welcome back to Ask Dr. Walt.
Thanks for having me on, Dr. Walt.
Well, our time is short, and we've got a lot to talk about on consumerlab.com under your treatment of cold monograph. On the website there, you've got lots of different options. I'm going to start with the one that's generally considered the most effective, to be in the vitamin C, and particularly the zinc category. When we talk about zinc and the treatment of common cold, what's the latest news on zinc for the common cold?
Right. Well, the most important thing is to know there's really two sides to zinc. There's zinc lozenges, which may be helpful in shortening the duration and reducing the severity of cold symptoms. And then there's zinc supplements. Now, you actually, most people are not deficient in zinc. During COVID, a lot of people were out there still are buying a lot of zinc. That's not really what helps reduce a cold or symptoms, the zinc supplement. In fact, if you take too much zinc, over 40 milligrams a day, which isn't hard to do with some of these supplements out there, you actually reduce your absorption of copper, which you need for your immune system. So you don't want to be taking so much zinc that you're actually becoming copper deficient. Sometimes when there are high zinc products, they'll actually include some copper for that reason. Actually, some of the eye supplements that are out there, the AREDS formulas, things for macular degeneration, have a lot of zinc. They also put a little of copper in for that reason. In any event, if you're trying to help with a cold that you already have, like you right now, a zinc lozenge can help. But the way it works is actually it works in your throat, in the back of your throat. So you don't want to chew that lozenge. You don't want to swallow it. You want to try to keep it coated as much as possible. So the evidence for these, based on some, smaller but okay studies. I mean, there could be better studies out there. A lot of these are supported by manufacturers. Is that you should be taking it every 2 to 3 hours. It should contain anywhere from 9 to 23 milligrams of zinc, either zinc acetate or gluconate. Those are the two forms that have been tested and shown to be helpful. But again, you don't want to be. We tested, for example, a zinc meltable like film that you could put in your mouth and suck on that, but it would be gone so quickly that it's not going to have that ongoing kind of coating effect on your throat. So that's what you should be looking for with a zinc lozenge. The biggest brand out there, Coldies, and they've funded a lot of the research. That is one that I would recommend, but you can actually get essentially the same ingredients as a lozenge from something like a Walgreens zinc lozenge. Also has about 13 milligrams of zinc in it from the same form, for, I forget, maybe 4 cents or something. So those are my thoughts on zinc. Make sure you understand it's a lozenge you want, not a pill.
Yeah, so let me give our viewers some information. I've been a subscriber to ConsumerLab.com almost 21 years now. We have no financial connection. I'm one of your consumers, and I love it. I couldn't practice medicine without ConsumerLab.com. So it is a subscription service, and it's constantly updated. Most of your reviews, for example, zinc or vitamin C, are updated roughly every year. You tell us as consumers what products have been approved. They have the right amount, they're the right quality, they're not contaminated. So the approved products, you tell us the price so that we can go from the lowest to the most expensive. You tell us if they're kosher or not, if that's important to us. You tell us if it's vegan or not, if that's important to us. But one of the things you do warn about, and I think this is very important, is that the zinc nasal products, the gels, for example, may actually be harmful.
Yes, people have actually lost sense of smell from a product. I don't believe it's still sold, but it was from Zicam. It was to coat the nasal mucosa. So you don't want to do that. You don't want it in your nose. You want it in your throat.
Unfortunately, Todd, our little boy, when he was young, hadn't heard your advice, and so he took a zinc lozenge and put it up his nose, as little boys are prone to do. I want to go back to a couple of things you said, because people who are subscribers and they get a cold like I do, they can go to ConsumerLab.com like I did last night, and they can look at the information on what works, what the studies showed. They can look at your top picks. And you emphasize that there's lots of different zincs, but zinc acetate and zinc gluconate are the only two that have been shown to work. And so on your list, you'll have those as approved products. They have to have the right zinc, correct?
The right zinc, the right amount, and the right instructions, which is very important as well, because a lot of these zinc products out there give you the wrong instructions. It'll say, take as often as you want, or it'll say, take it every 8 hours, but you really need to take these every 2 to 3 hours and let it dissolve. Don't chew it.
So the literature, the research says that somewhere around 75 milligrams of zinc acetate or gluconate spread over 12, 14 hours. So you're right, it's every couple of hours. These lozenges can be as little, the ones that are approved, can be as little as 9 milligrams or as much as 23 milligrams. So if I choose the one that's a little bit higher, would I take it a little less often?
You could. I think they've done the studies kind of both. Typically, you still really want that 2 to 3 hour period because you want to keep your throat coated. I would go with the lower amount, the 13 milligrams, because again, too much zinc is not a good thing. Too much of anything is not a good thing.
So 9 to 13 milligram lozenges taken every couple of hours through a 12 to 14 hour day over what, 2-3 days?
Yeah, you can do it for up to a week. You don't really want to do it for more than a week because you're really getting a lot of zinc, and you don't want to become copper deficient by taking it week after week because as it inhibits your copper absorption.
We went over to the pharmacy at Costco this morning, and we're looking at the zinc lozenges, and there's a slew of them. I was fortunate to have your approved list, and so they had 3 that are on your approved list. They had Cold Ease, about 12 milligrams of zinc gluconate. They had Zicam Cold Remedy Ultra Crystals, about 14.5 milligrams of zinc gluconate, and then also Nature's Way zinc was approved. And what really was cool, and ConsumerLab.com does this, they don't just say what's approved, but they tell you what it costs, what the average price is. So that allowed me to know that Nature's Way zinc, by the way, I'm not a salesperson for Nature's Way, but Nature's Way had the lowest cost per lozenge, about 62 cents per day. I love that about ConsumerLab.com. You help us choose wise products, but also save money.
Sure, you can spend so much money on supplements unnecessarily, or you can really be smart about it and get a good quality product for very little.
Yeah. Although you're right, as I understand it, the nasal sprays, nasal gels are off the U.S. product, but they're still available on the internet. And the last time I checked, this was just a couple of weeks ago, there's over 130 reports in our country of people who have lost their smell permanently from these products. So be wise and stay away from those products. What about vitamin C? Gosh, that's been controversial among us doctors. For when you and I were in medical school, they were debating vitamin C. So I love the fact that Consumer Lab is up to date. Literally, studies published last week are in consumerlab.com now. So educate me and our viewers. What's the latest on vitamin C and the common cold, both for prevention and for treatment?
Right. So, I come across so many people who are mega dosing on vitamin C, and they swear by it. But the evidence, the amount of vitamin C that you need as an adult is about 90 milligrams, 60 to 90 milligrams. Kids need less. There have been some studies that have shown that if you get more vitamin C, 500 milligrams, maybe 500 milligrams twice a day, you may be able to reduce the risk of getting a cold. Really, the best study, which wasn't a great study, was I think it was marathon runners, and because they're under a lot of stress. People who are doing these kind of extreme sports, your body's under a lot of stress. Vitamin C is an antioxidant. And so they found that there is a phenomenon of post kind of marathon colds that people get. And if they took vitamin C, I believe 500 milligrams, maybe 1,000, they had a lower risk of getting those colds. There's not really a ton of other evidence for vitamin C, but you should definitely make sure you're getting enough vitamin C around cold season to help possibly prevent a cold. Once you get a cold, it is not going to help you, unfortunately. As long as you're not deficient in vitamin C. So, and you can certainly get vitamin C from foods, oranges, etc. First, always, go with food if you can. But you can get too much vitamin C. The upper tolerable intake level is officially set at 2,000 milligrams per day, at which point you have an increased risk of diarrhea. For kids, it's even less. There's also some evidence that even getting more than 500 milligrams per day might increase your risk of cataracts. And so, you see this with vitamins. When you get, there's kind of a curve where at one point, as you get enough and become sufficient in it, it's just super helpful, almost miraculous, some of these vitamins, vitamin D, etc. You get too much and you start to reverse, some of those benefits. And people need to really keep that in mind.
Yeah, a couple good points. I tell my patients who choose to take vitamin C to be 2,000 milligrams or less, and warning them that above that abdominal distress, the diarrhea, the nausea, even kidney stones and kidney damage, and then for older, of course, the possibility of an increased risk of cataracts. And it brings up a good general point, Todd, and that is kind of twofold. One is I'll have patients who say, well, I've been told that if I buy this, there's no side effects. And I say, well, I can guarantee you if there's no side effects, there are no effects.
Right.
Everything has potential side effects. And if you go to consumerlab.com, you're going to learn what the potential side effects are, what the interactions are with foods or other medicines or lab tests if they're there. You'll be an informed consumer. You'll be able to buy the least expensive of their approved products. And Todd, I need to emphasize, pharmaceutical companies, natural medicine manufacturers, they're not paying you for these approvals. You're doing the approvals to your subscription base.
Yeah, well, just to clarify, so most of the products we purchase are with our subscribers, membership fees, as you pay and others pay. We do allow companies, if they want to have a product voluntarily tested, to get it tested through the exact same mechanism that we use when we buy the products on our own. So they do pay a fee, and we go out and buy it off the shelf. They can't send it to us. They're not involved in the testing. And whatever we find is what we find, and that's, they have to live with that. Hopefully, if we find a problem, they'll fix it. So companies can do that, and we do distinguish any product that comes in that way, just so people know that it came through our voluntary quality certification program. And that's actually one of the oldest programs in the country. But we think it's a benefit to consumers because it allows us to test more products and hopefully find other good products that are out there on the market.
Yeah, I love how you guys do that because you tell us as consumers, here's the ones we purchased. Here's the ones that they paid us to voluntarily be part of. And you publish what you find, good or bad. You've had reviews where the company has vociferously disagreed, but you save samples so that they can be retested. And you inform us as consumers of every step of that way so that we can keep up with it. I really like that.
Yeah, and it's very interesting because when a company, says, "Oh, Consumer Lab is wrong," how can they made a mistake, and then we say, "Okay, show us the evidence," and then we say, "Okay, you know what? We have a reserve sample, as you mentioned, and we're happy to send it to another lab if you're willing to publish the results." And that's kind of what stops them in their tracks because they don't want to publish those results.
Wow, I was looking at your recent review on vitamin C. You tested 31 popular products. Most of our viewers would know most of the manufacturers. 10% of them failed because they had more vitamin C than indicated on the label. So even as a consumer, if I'm trying to not go above that dose, but I buy something that's improperly labeled, I can harm myself and not even know it.
Sure. I mean, companies will put in a little bit more, and they're allowed to put a little bit more in because it has to be 100% through its expiration date. But sometimes they'll put in twice, 3 times as much. Sometimes they'll blow it out of the ballpark completely. So that can certainly happen.
I love how over the 21 years that I've followed you and consumerlab.com, it seems that the industry is starting to listen. They're starting to improve a little bit. One example is vitamin C. I remember an earlier evaluation that you guys did, 27% just over 1 in 4 products failed. This time it's 10%. Sounds like it's going in the right direction.
I think it is going in the right direction. I'm sure it will never be perfect, or even. I think we're probably plateauing a little bit where we are now. But there's a lot of pressure, especially on bigger companies, not to make mistakes. There's greater awareness on how to make these products properly. They know that people like us are out there. We're not going away. We were actually attacked by the industry early on, about 5 years into what we were doing. They really wanted to kind of squash us. We fought back, a lawsuit, and they stopped. So I think they understand, there's a place for people like in groups like Consumer Lab, and others, to be checking on the quality of these products. And I think they're doing a bit better job now.
Good news, and congratulations for that. Other products that you've reviewed for colds, I think of other products as being perhaps less efficacious, but anything else that you guys have recommended? Zinc and vitamin C have the best evidence out there, as you mentioned. We tested elderberry, which grew in popularity, especially during early parts of the COVID pandemic. Mm-hmm. Huge variation in the elderberry products. Not tremendous evidence that it, certainly there's really no evidence that it helps with COVID anyhow. But really, even one of the major makers of elderberry has even changed its formula from what was used in the clinical trial, which was like shocking to us. So not a fan of elderberry as a supplement. We do have an article all about all the different supplements that have been used for COVID, and another one on colds. But really, the two that you mentioned have some of the better evidence. Yeah, I guess if we're going to talk about upper respiratory tract infections, we can't ignore the elephant in the room, which is COVID. And I think a lot of our viewers are wondering, where's truth? Who do I believe? This side quotes this science, this side quotes this science. And one of the things I've always appreciated about you, Todd, and your COVID site is you don't have, an ox to gore in this thing. You literally want to let us know as consumers, as healthcare professionals, what works, what doesn't, what's harmful, what's not, what it costs, what you would pick, what you would give your family, what you would give your kids, so that we can make a wise decision. And I like on the COVID site how you sort of broken down the supplements into those that have been shown to be harmful. Stay away from these. There's not only no evidence that they help, but there's evidence that they may harm you. And then at the other end of the spectrum, you have those supplements that may be helpful, particularly if you have deficiencies like vitamin D, for example. And then the middle category where we just don't really know. And you guys update that literally, daily, weekly?
Daily, yeah.
In fact, I love when I get my little newsletter, just so you thought I was so smart. No, I'm not so smart. I just have great sources, and consumerlab.com is one of them. But so when Todd and his staff send out a newsletter, electronic email, and I get to read the categories, and I'm able to update myself, update my patients, update my neighbors, folks in our faith community who are asking these questions, and know that I'm giving them accurate information. What I really like, Todd, I've never told you this, but in the newsletter, you might have a new study on vitamin D, and I click on that, and I go to this big monograph. It's pages and pages and pages, but all I want's that paragraph, and that's where you take me. And it's highlighted in yellow. And even a dummy like me gets right in, gets the information I need, and gets out. And I really appreciate that.
We try to make it easy, but I'm glad you appreciate that. And we change that highlighting as we add new information, obviously. And I have to say, Dr. Walt, that I really greatly respect your take on healthcare, on medicine. It's very sound advice. So it's always a pleasure to talk with you, about these topics.
Todd, I appreciate that. I think we both, since medical school, have been the type of doctors that want to practice trustworthy medicine, evidence-based medicine, and be able to inform our patients in a way that they can understand it, that they can apply it. And I'm going to let our viewers know there are other sites available that do what Todd and Consumer Lab does. I just find this the most complete and the most consumer friendly, which is why I use it literally on a daily basis. And Todd, I build my patient education products around some of the information that you have. I always give you credit
Sure,
on the copyright. So as we look at your COVID site, I'm imagining you've had people that are positive about it, some that are negative because they may believe very strongly in this or that supplement and you don't find any evidence. Have you had pushback?
Oh, yeah. I'm sure we've lost some subscribers and, give them a refund if they don't want to hear the evidence-based information that we're providing. But, that's not going to stop us from providing that kind of information. Yeah.
Well, I've loved the site for years. If I have patients with arthritis or bone thinning, hair loss, they're interested in weight loss products, they're bodybuilders and they want protein products, even some of the medical foods that you evaluate, it helps me be a better doctor. It helps my patients be better consumers. And I can foresee us, I hope, doing some more shows together to give our viewers kind of the general information, and then they'll know where to get the specific information for them and their family. Todd, thanks.
Thanks. It's always a pleasure. Thanks for having me on.
Good to see you. Well, before we close the show, gosh, time's going quick. I want to tell you about a couple of books I've written on natural medicines and alternative medicine. The first one's called The Natural Medicines Handbook. The subtitle is The Truth About the Most Effective Herbs, Vitamins, and Supplements for Common Conditions. Dr. Cooperman served as a consultant and an editor, and that book could not have been written without him. The second book, Alternative Medicine, The Christian Handbook, has been endorsed by the Christian Medical Association as medically reliable and biblically sound. And you can find both of them at drwalt.com. That's drwalt.com. Just click on the tab that says books. Also at drwalt.com, you can sign up for my daily medical news you can use or my Apple a Day blogs. They're completely free. So finally, if you have any questions, anything you want to challenge me on, drop me a line at Dr. Walt, drwalt at liftable.tv. That's Dr. Walt at liftable.tv. So until our next visit, dear friends, I pray that you may enjoy good health and that all may go well with you, even as your soul is getting along well. I'm Dr. Walt Larimore, and I look forward to seeing you on our next episode of Ask Dr. Walt.